So today have invited Dr. Melissa Carr to give. She's actually got a few case presentations. She's a registered doctor of TCM in practice since 2001. She has a degree in kinesiology and worked in medical research in Japan prior to her TCM studies in both Canada and China. As a result, she loves to blend Eastern and Western natural health knowledge and therapies. As a passionate educator, Dr. Carr has been a teaching assistant for anatomy, a nutrition instructor, and has served on the editorial advisory board for Alive magazine and integrative practitioner. She continues educating the public about natural health matters and TCM via lectures, including to the David Suzuki Foundation and the NUBC. And her work has been featured in Alive magazine, integrative practitioner, European Journal of Pharmacology, and the Oprah Winfrey Network show, BioLogic. Over more than a decade, Dr. Carr wrote the book she wished she had as a student. And in January 2025, Singing Dragon published and released his book, Modern Chinese Medicine Food Cures, a Personalized Approach to Nutrition. Thank you very much, Dr. Carr. Welcome, and I will pass things off to you. Oh, sorry. I wanted to remind people to please write any questions that you may have in the Q&A below. And after each case presentation that Dr. Carr finishes, then we'll get to the questions. So we'll have a bit of a discussion in between. Thank you.
Excellent. Thank you so much. Thank you so much for inviting me today to be able to talk about one of my favorite topics, food. Pair it with Chinese medicine and what can be better. I'm really pleased to be able to share some experiences that I've had in clinic. And as was mentioned, I'm happy to answer questions as well. So feel free to ask away. So as mentioned, I've been in practice since 2001. And my background was more of a Western approach. Coming into Chinese medicine, it was a brand new thing for me. I was not interested in natural health before sort of discovering for myself Chinese medicine, and it changed my world, as I'm sure it has for many of you. I'm just going to share my screen here, and tell you a little bit about what we're going to cover today. So I am going to give a little bit of an intro before we go into some of the details. But like the thing about nutrition that I really love is that it really fits with Chinese medicine. I really think that more and more people are becoming interested in natural health. More and more people are becoming interested in nutrition. There's a ton of information out there. People are looking for what is the right way to eat. And as TCM practitioners, we understand that it really is personalized. It depends on the individual. And so there is no one perfect diet. There is no one ideal way. And Chinese medicine is perfectly positioned to be able to understand this and explain this to our patients. So I'm hoping that some simple, some takeaway points today will be some simple tips for how to use your TCM food cures with your own patients. Maybe understanding how a patient's relationship with food can be really key to how you have the conversations, because food can be quite an emotional topic. And it's not just what a person eats, but also how and when that really matter. Those are some of the takeaways that I hope you get from some of the cases. And Shu Liao, or like TCM food cures, I don't understand why it's not as recognized as I feel that it should be. I really feel like this is a really powerful thing. And sometimes I have patients come in thinking they just want acupuncture and like, oh, by the way, do you know of a nutritionist that you can recommend for me? And I'm sure you guys have heard that at times. And I say, well, I can absolutely recommend a nutritionist, but also I can talk to you about food, and I'd love to talk to you about food. I'm curious to know when you guys do enter your questions and things, Tell me a little bit about if you use nutritional recommendations. If you make nutritional recommendations, I think we need to go beyond the don't eat only cold raw foods and avoid like eat soups and stews and beyond don't eat greasy fried foods. I think we need to go beyond that as TCM practitioners. I even provide TCM food cures to patients who just come in for like a simple like their first visit is like an ankle sprain. I'm like, okay, do you mind if I share some anti-inflammatory food recommendations for you that might help speed up your healing? Um, so I think that we can ask ourselves how we can use TCM food cures to help our patients. And so, as I mentioned, like, what is the right diet? An apple might be a fantastic, the butterfly here, a great, wonderful thing for somebody, one person, and then something that feels like it's injuring them for somebody else. So, just like this word here. So you might see one word pop up, and then if you look again, you might see another word. So good and evil within the same thing, me and you within the same image. So this is how I think of what is the best diet or foods to have. It really depends on you. These are some of the questions that I think about. I may not directly ask them of my patients, but I'm thinking about when I'm having a consult with my patient. I want to know, do they enjoy their food? What are their health goals and needs? For sure, that is something that all of us ask with regard to nutrition, even if they aren't coming for digestive issues. I'm curious to know how they feel when they eat. And do they take the time to savor their food, because that can really alter their experience. So I'm going to dive into the first case study here. Um, so as mentioned, I have 3 case studies. I'll take questions at the end of the first one about anything that I've already covered or this case itself. So this one I call a slice of pizza and half a beer, which you'll find out why in a little bit. So I had a 26-year-old patient struggling with fatigue, allergies, digestive disorders, and anxiety. She was really she was really limited in her diet. She was only eating steamed broccoli, white rice, and rarely a bit of chicken. She had had a lot of issues. She had seen a naturopath who diagnosed her with candida, so she was put on an elimination diet. Now, that absolutely may have been the right response for her, and because it did initially reduce her bloating and gas. But once that stopped, she didn't go back to the naturopath, she didn't continue that, and she just thought she would just manage it on her own. What happened is that, and at the time she saw the naturopath, she was found to have a number of food sensitivities, so she thought she would just get rid of those foods and then she'd be fine. But she didn't really continue anything beyond that, and what ended up happening was that that list of foods seemed to grow. So the things that showed up as sensitive for her, she started to feel like she became sensitive to more things, so that it became so limited, like I said, only down to steamed broccoli, white rice, and occasionally a little bit of chicken. Um, she was scared to eat. So, the more she because the symptoms were continuing, and some of them seemed to be getting worse, the anxiety was triggering her digestive issues were triggering her anxiety, and everything she was blaming on food. So she basically had given herself an eating disorder. Um, so my goal, which I had to get her to agree to, was to expand her dietary choices. She was really scared to eat anything. And so I really wanted her to get on board with the idea that we were going to strengthen her digestive system, calm her nervous system, and help her to little bit by little bit step her into a normal world of eating. So her diagnosis was spleen chi deficiency, chi and blood deficiency. It's clear she was very deficient because she wasn't really eating very much. She had lost a fair bit of weight as well. So I asked these questions. I wanted to know how it all started, what was going on in her life. How did she feel about eating and about food in general? What foods did she really miss? Because I figured that there must be some foods that she used to enjoy that she felt were problematic now, but she really wanted to be able to eat again. And how did she feel about expanding her diet once more? Um, so with this, she said how did all of this start? She started because, sorry, let's switch that back to there. With the start, she had a very stressful time in her life. So she was going through a lot of stress, and the digestive issues started. And we talked a little bit about, how that was, even though those issues were no longer present, she never really got past that stress. She was really terrified about eating again, and she was nervous about having anything. She missed having a pizza and a beer. She missed just going out with her friends, going and doing things that she would normally do, go to the movies and have a thing of popcorn, be able to go out with her friends and eat with them. She'd stopped going to restaurants with her friends because she couldn't just order plain rice and steamed broccoli. So she stopped going out to the restaurant. So she missed going out and having social experiences. She was nervous about expanding her diet. So what we did is I said, we're going to start with some acupuncture and herbs to address her TCM pattern. So our first goal was really to strengthen her digestion. It was really to make sure that I said, your body is built to be able to take food and turn it into the things that your body needs to do the repair and growth and get you through your day. So we need to just repair some of the areas, and we really need to calm your nervous system, because getting into the sympathetic nervous system state meant that she was in more fight or flight as opposed to rest and digest. So we needed her to be in rest and digest in order to be able to digest her food well. So, because this cycle of anxiety and digestive issues had looped into each other, I really needed her to be on board. So when we're dealing with food stuff with people, because there is often a lot of emotion, I needed her to be on board with whatever we were going to do. And so, I asked her what she would be willing to start with. And she said really small. So I said, okay, great. What about if we just up the flavor of your food? So let's start with, once we got her into the acupuncture and herbs, I said, because the herbs are essentially, a lot of them are overlapping with food. So if in her Chinese food, sorry, or Chinese herbal formula, there was some ginger, there was some chen pea, some tangerine peel, there were foods in there that also that were herbs. So I said, you've got some of these things that you've avoided as foods are actually in your herbal formula, and you're feeling a little bit stronger. Let's start adding these things in: ginger, peppermint, cardamom, thyme, fennel, all these things. So these were foods that I knew would also support her digestive system, as well as just start to build her confidence, and also add flavor to her food, because her food was so bland. And then one by one, we started choosing foods that were similar to what she was already eating. So she was eating plain steamed white rice. So we added brown rice. So I said, let's choose foods that are as similar to what you're already having, so that it doesn't feel like you're branching into a totally new territory. Cauliflower, a little bit of salmon. I needed her to have more protein. So, adding in foods in very, very small amounts. I said, even if all you get in that is just a bite, that's okay. We're gonna microdose your food in just to get you used to the idea, and build the trust with it as well. And see if, like, I mean, I was really trying to balance the, see if you feel any negative experience with it. I didn't really want to say that way. I wanted her to go into it feeling that this was going to be an easy, positive experience with each new added food. And then I had her doing, we really needed to focus on calming her nervous system with breath work and acupressure points before eating. So actually have her sit down before eating anything, calm her nervous system. So do some deep breaths, practice some acupressure points prior to doing, having the meal. And then during the meal, eating it mindfully, having some positive thoughts during about it, like, almost like a mantra, like I'm this food is fueling me. I'm going to feel more energized because I'm able to get more protein into my body. I'm going to feel better about the food because it actually tastes better. Um, and making sure that she really chewed her food. We talk about the digestive system and how the chewing the food better would make it easier for her body to be able to break things down and use. I didn't really worry about any giving her too much specifics because I didn't want her to feel like I wanted her to break her out of the diet mode. And so we talked as well about foods that would fit her pattern. So, like sweet potatoes, yams, soups, stews. We did get some specifics about those. But I said, you can add in more food and share with me, your victories, your small victories, baby steps. So the results, at first I saw her weekly for acupuncture, but after 4 sessions, we dropped it to every other week. And she was on the formula, custom formula, uh, that I changed throughout the process, but she was on that through this whole time. I also suggested she include some digestive enzymes in order just to make it a little easier for her digestive system. Because I felt like she was missing a lot of things, I suggested that she take a multivitamin mineral. We actually just did a food-based one because I figured that would be the easiest for her to sort of uh, create that bridge over between food and supplements, food and nutrition. And then, because she had tested low for iron and B12, it was recommended that she also include those. After about 3 months, she was really excited. She came in and she told me that she was able to go out with her friends and have a slice of pizza and half a beer. And we've celebrated that. That's not normally the kind of thing you're excited for your patients to be eating, but I was really excited because she did it and she felt good and she was able to enjoy a normal experience with her friends. So the lessons I took from this were that making food changes could be emotional, and some people are really afraid that they're going to mess it up. They're going to make things much much worse. And really really baby steps. So finding whatever level would work for them. And you'll find this across all my cases. I encourage mindful eating and calm eating. So I think a lot of us, and I grew up and I was very active. I was a figure skater, and sometimes I was really busy, so I'd go straight from school to skating, and I'd have my dinner would be a hot dog that I would be still eating as I was doing my warm up around the rink. So not exactly the healthy way to do it. I encourage not doing that kind of thing. The end of the goal isn't to eat perfectly. A lot of times people are trying to just get it right, especially if they have a lot of metal element to them. They might be just trying to eat what is the right way for me to eat? Tell me exactly what I should be doing. I really want people to understand that food should be enjoyable. And then find out what their goals are is really the other key piece. So before I go into the next one, are there any questions?
Thanks, Dr. Carr. I sympathize with your hot dog eating as a quick sports nutrition. I had the same experience.
Right? And I mean, hot dog, that's the worst thing as a kid. Like, that's a choking hazard.
Yeah. But it's really quick.
Really quick.
I think everyone can kind of relate to, whether it's with their patient or even themselves, really searching for, how do we eat so that our body feels good, and not being scared to think of things a bit differently.
Yeah, I think that the thing is that, people if they've had a bad experience with food, they're afraid sometimes that it's going to be a repeat experience, or they're afraid that they got better with, to some degree, and they're afraid to backslide, so they become afraid of a food. And maybe there's some foods that really shouldn't ever enter their list. Like, I can't eat quinoa, which is kind of an unusual, like, it's not, I mean, not unusual, but it's not a super common thing that people have a problem with. But I know that I can't eat quinoa. It causes back pain for me in my mid
Mm,
back. And I know it's a very specific thing because when I've accidentally had it, I have that feeling. And then I, go back and I'm like, oh, that pizza crust had quinoa in it. I didn't know that, but my body sure knew that. So there's certain foods for sure that, you want to avoid, but not having to be too rigid about it, and know that our bodies were designed to eat a variety. And so, many of us fall into habits and ruts, and so checking in with our patients about that can be
is
valuable.
part of your checking in with the patient also coaching them through what some of the feelings that their body might be feeling, like how they can interpret those? So, with this case presentation, once she started eating, you started off really slowly with foods she's comfortable with. Kind of once she got to that pizza and beer stage, was it then about coaching her to understand that maybe the feeling isn't that you now have to start all over again, but it's just about readjusting or trying something different?
Yeah, so after that point where she got to the, okay, I feel like where I've left off here, it was having her understand that she could continue to expand her realm of food choices. Obviously understanding that, she wasn't trying to just eat, I wasn't encouraging her to eat junk food, but that every time she had something that wasn't ideal, that she just keep, like, I have an 80/20 rule. I'll tell people, if unless they're really in a dire state, most people, I put them in an 80/20 rule with nutrition. So I'm like, 80% you're mindful, this is feeding, you're fueling, this is the right food for you. And up to 20%, it might be less than that, but up to 20% can be because I really enjoy this. Like, so it might be 90/10 for somebody else. It might be 95/5 for something else. But I'm going to encourage that, that it doesn't aim for perfection with it, that we're going to some level of, I just have this because I'm really enjoying it. So for this patient, it was having her be a little bit less keyed into every time she had a symptom that it was because of a
Mm,
food. And that, also having her understand that sometimes you have something and it's a delayed response, and sometimes you can have something and it's an immediate response. It's being mindful around the foods you have, but not being really hypersensitive about every single thing you put in your body. It's that
right.
balance.
Yes. Yeah. I like that. Bring some joy into the eating. Okay.
Absolutely.
I'll let you get on with the second one. I don't think we have any questions.
Perfect. Okay, second case. So this patient was upset because the title is Upset It Worked. So patient came in, 34-year-old patient with bloating, fatigue, loose stools, diarrhea in the morning. You know where I'm going with this. Always feels cold, heavy periods, weight gain. So, she had been following a raw vegan diet for a couple of years. She was very into this particular style of eating. She had built a community around it, and she had done tons of research about it. She knew more about this than anybody that I had met. I sometimes patients come in with more information about a particular health topic or a way of doing something, or a supplement or a disease, than more information about it than we as practitioners know, because they've gone so narrow focused on it. That was this case. She was really narrow focused on the raw vegan eating and very committed to it, and all of the health benefits. She was also resistant to see, but she was feeling all these symptoms, and she was resistant to see a medical doctor about getting any blood work. I asked her about the blood work because I wanted to know, following this diet, how were her B12 and iron levels? Because on a vegan diet, certainly you can get the iron, but it's without supplementing, you can't really get the B12, like because you're just not going to get the absorption even from things like spirulina. So I wanted to know those levels. She didn't have them, so my assumption was that they could potentially be low. Um, and we talked, and because her digestion was so poor as well, so even though some of the foods that was eating were probably rich in iron, her digestion was so poor. I was just assumed that her absorption of nutrients across the board was probably poor. So her diagnosis was spleen yang deficiency cold. So automatically, many of us, we automatically get the ideas of some TCM herbal recommendations we can make, some Chinese medicine, acupuncture points that we can do. Um, I really wanted to dive into the nutritional piece with her because I knew that that was not really serving her. She was very resistant to eating. So I was not going to suggest that she eat any animal products. I knew that the vegan part was the bigger piece for her. And so I really wanted her to include some cooked foods. That was where I really wanted her to begin. But she was extremely resistant to this. As I said, she built community around this and she had lots of information about the benefits of it. She questioned, if she were to cook the food, it would destroy the vitamins. And I said, yes, some of the vitamins will be lost in the process of cooking. However, the breakdown of the foods will make it easier to digest. So you're going to get better absorption of the nutrients that are still there. Um, and I said, and if we can strengthen her own digestive system, she will have enough enzymes that her body's producing to be able to absorb the nutrients that are there. Um, so, oh, and the enzyme, she was that was the other thing. She was also afraid that the cooking would destroy the enzymes, not the vitamins, but the enzymes. So I assured her that if it was broken down, it would be easier to digest, and her body would have enough enzymes. So I said that I would suggest that she continue to eat vegan foods, but try just for 1 week. So sometimes, again, small steps. So I said, can we just try an experiment here? I said, what about if we just do this for 1 week? 1 week, you try cooked foods. And I said, as much as you can, maybe it's not exclusive, but maybe at least 50% do cooked foods for the 1 week. And I suggested that she could use raw culinary herbs and foods that are warming. So the option B, so if she didn't choose that, I said that we could try the raw culinary herbs and foods that are warming. Eat raw, but just add in the warming herbs. But I did say that's not probably going to work as well. I suggested that she add the cooked foods. Either way, I said we will do the acupuncture and herbs to try to make it work. If she did not want to make any dietary changes, I said we could just do acupuncture and herbs. However, I felt that it wasn't going to change enough for her, and she was going to end up being back to see me for more, and it was going to be more work this way, more effort for her. I didn't feel like it would be as lasting, the effects. I also recommended that she take a sublingual vitamin B12 because I knew that that one would be deficient, and I suggested that she include an iron glycinate on alternate days. There's evidence that it shows better absorption on alternate days than taken daily. So I left it. She when she left after that first visit, we'd done the acupuncture. I'd given her the herbs, but she wasn't yet she wasn't yet clear of whether or not she would do the dietary changes. However, so the next week she came back for after her first visit. She was visibly upset. And I asked her what was wrong, and she said it worked. And so she did eat the cooked foods that week, and she felt considerably better after the meals. So, yeah, so I also had her taking formula. I had her doing moxibustion at home and getting acupuncture was continued. So she was upset that it worked. She had hoped that it wouldn't, that the eating the raw foods was still the right thing for her. Um, so she was upset that the eating the cooked foods did help, but she was, she was happy she was feeling better. As the treatments progressed and we continued, she started to get better, less fatigue, less bloating, less loose stools. Her overall, she was feeling improved. She started steering back towards the raw foods again. But she did agree that occasionally she would eat some cooked foods, and she knew also I'd given her a list of the warming foods, the things like ginger, cardamom, cinnamon, those sort of chai spices and things that she could use, and to keep going with the moxibustion, especially in the colder months. So the lesson for this is that people can be really attached to their food choices, and that sometimes offering, so I offered her three options at that first visit. One was to include some cooked foods, 50% at least, and see how it goes. One option was to not do any of those, continue to eat raw, but just add in the warming foods and spices. And the third was, okay, don't change anything dietary, and we'll just do the acupuncture and herbs. And I gave her the list of what I thought would be best, which was the first option A. And then the second lesson is that the trend diet isn't always the best. And that wasn't my explanation to her, was that, for her, that diet might not be ideal. Didn't mean that it was a wrong diet for everybody else. Clearly, she had knowledge on that and information for that. Um, so I'd love to see if you guys have any questions on this. And in the meantime, um, yeah, we can talk about the what happens when with these, dietary trends.
Bad diet. I'm sure you must get those a lot.
I get a lot, and one of them is intermittent fasting, of course, right
Yes,
now.
yes.
I mean, I've got patients who rave about it, and I think fantastic. But personally, I don't make any recommendations for anything really if I wouldn't be willing to try it. I mean, obviously I'm not doing all the protocols that my patients are doing because it's not suitable for me. But I'm willing to try different diets and see, if, how do they feel. Intermittent fasting, I've told my patients that they would not want me to do that because if they're going to see me when I have an empty stomach, they do not have my brain power working. It's off. I I will not be functional and I won't be happy.
It's not for everyone.
Yes.
So we have a couple of questions. One of them was, can you please explain about the acupuncture points that you use for these cases?
Yeah, I mean, I think you need to look at your diagnosis. So I don't actually have my list of points here on these cases because I focused on the food, but I mean, like it was what was it? Spleen and kidney yang deficiency in this one. So spleen yang deficiency, so I'm using lots of spleen points, stomach points, kidney points. I would have done Sometimes I don't do both sides of treatment in one visit. Usually I do one side per visit because I like my patients to have a lot of rest time. I really want them to just decompress and, you know, have their mind get bored and disappear for a little while because they're just lying there with nothing to do. I want their brain to go into that other mode. So I might do the shoe points on one session and do face up, do spleen 6, spleen 9, Ren 6, stomach 36, kidney 3. I'll stomach 25. Depends on, the case. I mean, I think these ones are classic sort of formula cases.
Right, right. And do you use traditional matzo or?
I don't use moxa in clinic because my building doesn't allow for the even the smokeless moxa. It's tricky because of course the smell does carry. So I will sometimes give my patients, I usually give the stick format just because it's the safest and the easiest for them to do. And I'll often use the the smokeless one, just because again, sort of the safest one, the a little bit less likely to drop ash, I feel. But sometimes I'll get a higher quality one. Depends on what they're willing to do and what I happen to have, or I'll just recommend that they go into Chinatown and pick some up. I don't regularly carry it in clinic just because I can't do it myself.
Okay, so you send them home with a matzo protocol for
Yeah.
themselves. Yeah, okay.
Very
Um,
simple though. I don't even I like I'll have them do very simple stuff. I once had a patient who like I and with guidelines like don't fall asleep. Don't do it lying down sleepy. So I had a patient set his air mattress on like
oh,
he deflated his air mattress because he fell asleep and he dropped the moxa stick on his inflatable air mattress.
you wouldn't think that that was something you had to point out.
Yeah, I think sometimes you do.
Yeah, we just had a comment that the carnivore diet works for many people, but not um, at all a balanced option.
Yeah, I think, I don't do personally, I don't do any what I would call more restrictive diet or more extreme dietary recommendations. Personally, most of my recommendations are adding in foods more than subtracting foods. So I mean, obviously, if somebody has issues with a particular thing, I will recommend they avoid those things. If I suspect allergies, I mean, there's some things that I'll commonly, like I'll go to what I call the usual suspects for food, limiting or like dairy, if they food allergies, I'll give them a list of common food allergies like tomatoes, citrus, soy, peanuts, uh,
Yeah.
eggs, those kinds of things. But I tend to be more additive.
And my assumption is that by the time people come and see you, they're at least somewhat open to considering some sort of diet change.
Sometimes they are, but sometimes I always ask. So before, like even with, so in this case, I really encouraged her
Right,
to try some dietary changes because I saw that as an obstacle.
right.
Um, I have some patients, like I have one patient, I remember he came in and I mean his diet was all junk food. And as soon as I said, "Can I ask you about what you eat?" He smiled and he's like, "No." He goes, "It's bad." I said, "Are you willing to make any dietary changes?" He said, "No." I said, "Okay, well, then we don't have to, but I'm just letting you know that it's always open. It's always there." I tell my patients I think of like their health like I'm building on a foundation. So treatment is best done on a foundation. So the foundation for me is like a table with four legs. So I think about you need to have good, healthy nutrition going in. You need to have regular movement activities, so exercise. You need to have sufficient restful, restorative sleep, and you need to have joyful activities in your life. And I can make recommendations for all those things, but it's really up to my patient to do those things, to implement them. And I encourage all of my patients to do those things, but obviously I can't make them do any of them. I say, my treatment is on top of that. So if you like, I can I can help you down a path. But if those things, if there's only two legs there on that table, it's a pretty wobbly table. It's not really standing. It's hard to
Right.
build a treatment on that. It's hard to build real growth on that.
Um, we have one question. I think that you've kind of covered it in your philosophy. What do you think about people that have only one meal a day? Does it work for some people? Do you generally think it doesn't work or
I mean, I think that so that's like the intermittent diet sort of principle. And I get the idea that you're giving your digestive system time to rest. I do think it works for some people. I don't think it works for everybody. Like I had uh I had a patient who so was diabetic and had kidney like um very bad kidney, like their blood tests were showing up really poor for kidney function. Very poor kidney function. And they were put on an intermittent diet with it was a ketogenic intermittent diet. And I watched his kidney markers get like so he came in and I asked him for his blood work and I saw what it was and what it had been prior to him going on the
mm.
diet. And the blood sugars were way worse and his kidney markers were way worse. It wasn't working for him. So we shifted gears. I get that so he was put on it by a nutritionist. I get the nutritionist had probably had some experiences where that had been working for somebody else, but it wasn't for him. And it was heading him towards kidney failure.
Oh,
So I needed I we had that conversation, which is a difficult one because you have to sort of like not I didn't want him to go, okay, well, they didn't know anything about what they were doing. Maybe they didn't have the full picture, or maybe, maybe there was a next step. So it's sometimes a little tricky to have those conversations.
and how did that resolve? Was
Yeah,
he
so he did better on a more for him, he did better on small, more regular meals, and he needed to eat less meat. That was what worked for him.
and you were able to see the kidney levels come down?
Yeah.
That's great.
Yeah, we switched him off of things like I mean, we still wanted him to have enough protein, so we switched him into more fish and things, then off and less uh, beef and lamb and some of the stuff that he was doing.
Have you ever had a patient with insulin resistance with similar dietary issues? Do you find that ethnic background makes a difference in results, making it more or less difficult?
Sorry, I think is there two parts? Is
There's
it
two, yes, sorry. There's two
okay?
two parts, yeah. So the first part, have you ever had a patient with insulin resistance with similar dietary issues?
I mean, yeah, so there's lots of people with insulin resistance. I've seen a lot of them. I mean, we look often in Chinese medicine to spleen qi issues, so addressing that, but um with similar issues as in fatigue and bloating and that kind of thing, yeah, absolutely. So I think that I look at what are they doing for like sometimes it can be that they're doing all the right things nutritionally and really I just need to bring the herbals in and do the acupuncture. It really is a treatment part on top of that. Um, and sometimes there are adjustments we can make in their diet. So it might be that intermittent diet works for them to help balance their blood sugars if they've got some insulin resistance, but it might be that small, frequent meals actually is the better one. So there's a little bit of trial and error that happens. So I always ask them, what have they tried? What has worked for them in the past? When did this start? How did they used to eat? Those kinds of questions.
And do you find that ethnic backgrounds make a difference in results?
I mean, I think about the ethnic part more about like what foods would be common for like all of us with like I'm half Japanese, so all of us with some Asian blood don't digest lactose as well. we don't produce enough lactase enzyme. So generally I'll put uh, milk products on the question mark list, and they may or may not be okay with it, but I'll put that automatically on the question mark list. I have a friend who's half Japanese, half Swiss, and she's going with her Swiss side when she has her cheese and her chocolate. Her body doesn't agree, but she insists that she's pulling forth her Swissness in it.
Yeah, that 20%.
Um, so I do think about those kinds of things and what would, what would be traditional things that would be included, but not really in terms of how, not really so much in terms of, whether or not it's, I don't think of it so much about like, oh, okay, it's harder to treat spleen chi deficiency for a person of that ethnic background or that kind of thing, if that was part of the question.
Right.
Perfect.
All right. Um, okay, should we do case 3?
Perfect. I'll go through this one a little faster just so we have, and I'm okay to go beyond the time as well, but I'll go through this one a little bit faster.
Okay.
Okay, so skipping through. All right. This one I called toast and tea, because this is you commonly happens for people, older adults. So I had an 83-year-old patient come in. She had osteoarthritis, osteoporosis, acid reflux. She was very thin. She had swollen joints, especially in her knees and her hands. Her joint pain was worse in cold, damp weather. So clearly she had cold, damp B syndrome. She didn't have much of an appetite, which is common for many older adults. You start to lose your sense of taste. It becomes harder to digest. Sometimes it's harder to chew foods as well. And especially for a lot of older adults, if they're living alone, they're lonely, food is a social experience. For many people, she just, it was hard for her to cook for herself. And so she mostly ate really simple things, canned soups. She would have toast or bread, cereal or oatmeal, fruit, and she didn't really like to cook very much. I get that don't like to cook part. As much as I love food, I actually really don't like to cook very much. So any recipes that I recommend are very simple. And for fluid, she mostly had tea or coffee. Um, she was taking Tums for her acid reflux and calcium carbonate for her osteoporosis, and she was on NSAIDs for her arthritis. Her TCM diagnosis was kidney and spleen chi deficiency, and she had cold damp B syndrome. So this one, the diagnosis, the TCM diagnosis, this case, I'm going to talk a little bit less about that really. It's important here for sure for what her diagnosis was, but really the key pieces that I saw were that she was missing a lot of protein. She wasn't eating enough. The acid reflux and the Tums was making her acid reflux worse. The calcium carbonate was making her acid reflux worse, and the NSAIDs were making her acid reflux worse. So the challenge was that she really didn't have much of an appetite and she doesn't like to cook. She was likely to have a lot of nutritional deficiencies. I figured she would be deficient in, again, B12 because she was not eating very much protein. She wasn't eating very many so B12 is an animal product. So you'll find it in dairy, chicken, fish, eggs, beef. You'll find it in animal products. And iron, I figured would be low as well. She also wasn't eating a much variety of vegetables. So dark leafy greens, stuff like that, that would be rich in iron as well. And other minerals that would really be, everybody thinks about calcium for the bones, but they're all important for the bones. So if you look at minerals, look up mineral wheel online, and you'll see all the minerals and the links that they have for each other, how they interact with each other. Just as we think about like the organs in our body in Chinese medicine, we understand that they're not separate from each other. They interact. So do the minerals, so they can either help each other absorb or block absorption. She didn't have enough protein or fat in her diet. She mostly carbs. And she did not want to take any Chinese herbs because of the cost, and she was afraid that it wasn't going to taste good. Um, so first thing I did, I suspected that she was probably deficient in B12 and iron and other things, but I did suggest that she talk to her doctor about it, because maybe her doctor could give her a B12 shot, and that would get the B12 up. Otherwise, she could take B12 sublingual. Would just dissolve it under the tongue, because B12 requires stomach acid, and requires something called intrinsic factor in your stomach in order to be able to be absorbed. And as we age, we also produce, so we might produce less intrinsic factor, and we will produce less tend to produce less stomach acid as we age. So I knew that B12 was probably be a good piece for her. A good multivitamin was probably a good foundational piece for her. And a good multivitamin, I want to say, like making sure that you can do a little bit of research about what that means. Um, and I do give information to my patients about what to look for, because I've got a lot of background knowledge in that, but you can do some research on that, or you can recommend they speak to a nutritionist or a dietitian about how to pick those, or speak to somebody at their pharmacy. A good bone supplement, I wanted her on a calcium MCHC, which is microcrystalline hydroxyapatite. Because I wanted a well-absorbed calcium. The carbonate is going to decrease stomach acid, and you need the stomach acid in order to be able to absorb the calcium. So I needed her to make sure that she was going to be able to absorb the calcium, and I wanted it in a form that had other ones. So most of the ones, if you see a calcium MCHC, they're in with a bunch of other minerals: magnesium, potassium, phosphorus, strontium, vitamin D. There'll be a bunch of other things in there that will also support bone health. And if she wasn't willing to do that, because they are more expensive, then I at least wanted her on a calcium citrate with other minerals in it. I also wanted her to consider, like, because she didn't really want to cook, would she consider doing a protein powder? I wasn't really fond of the sort of like those meal shakes that I forget what the name of one common one is, because I didn't want ones that were just higher in sugar. And honestly, I personally don't think they taste good. They taste kind of chalky and not great. But if that was all she was going to do, it was going to be better than what she was doing. But I did ask her if she would consider protein powder and maybe some fish oil supplements as well, to get some of the good fats in her. I asked her if she would be willing to add legumes to her diet. So I suggested, she didn't have to cook them. She could get the canned ones. Make sure to rinse them really well. If you don't rinse them, it's going to make it more gassy. And then just add those. So if she already had her favorite soups. Could she add a little bit of the beans to those favorite canned soups? And then maybe if she was willing, she could branch into other soups that already had the beans in them. Try things like hummus, tahini, nut butters. Nut butters are a bit tricky for older adults sometimes if they've got dentures or things like that in there, but I figured the hummus might be okay. Get the protein in there. Also, you have to think about whether or not they can chew the things very well. So soft foods might be easier. And then if she was okay with dairy, to consider including some yogurt or cheese, which she was on board with, because that kind of fit her vibe, to add in cheese and easy to add. Nuts and seeds, tricky if you do have chewing issues, but I said, if she wanted, she can try it in nut butters, and if not, then try it in nuts and seeds. Just make sure you could soak them in advance to make them a little softer, easier to chew. Or you could get some chia seeds, or you could do you can grind them. So I've taken flax seeds and made flaxseed meal out of it with um, a coffee grinder. Will do that. I've broken a couple of coffee grinders with doing that with it, but I mean they're not that expensive to replace. And or you can just get the flax meal on its own. Or she could do the flax oil and just pour it over her other foods that she was eating. You can't cook with it, but you can pour it over top of your foods. I also asked if she would consider, so for the reflux, if she would consider adding apple cider vinegar in water before her meals. It's inexpensive and an easy thing to do. And then drink more water and have herbal teas because the caffeine might have a little bit of a tendency to leach calcium out of the bones. I mean, it's not clear if that's 100% the case, but I just knew that she was dehydrating herself as well, so it would be a good idea to include other kinds of fluids. The results. So she was able to include things like increasing her protein with canned beans, having yogurt. She did actually like the nut butters on her toast. She was drinking more water. She had expanded into some herbal teas. One of the teas that I'd recommended for her was turmeric and ginger, like look for turmeric or ginger because of the anti-inflammatory properties to help with her arthritis. And she had limited to one small coffee in the morning, and she was happy with that. It kept her routine there. Her blood test did show that her B12 levels were low, so her physician did agree to do B12 shots. Meant that it wasn't an added expense for her, like a big added expense. She didn't have to do another supplement, didn't add to the list of pills. She stopped the Tums and she got a really good bone supplement and started doing the apple cider vinegar. And with these things, she had no more reflux, so she didn't need the Tums anymore. And then we managed her joint pain with acupuncture. And so she still occasionally needs some painkillers, but it was less than what she'd been doing previously. So another thing less on the aggravation that tended towards the reflux issues that she was having. So the lessons, so aging changes our nutritional needs. So that's something to consider. So, and we do that, we should consider that when we're doing herbal prescribing as well, that it changes how our bodies metabolize. And that sometimes when we can't do herbs, we can look to food. So if you're an REC, you can still make nutritional recommendations. Or if your patient won't do herbs for whatever reason, you can definitely lean into foods. Yeah, so any questions on that? And while we're waiting to see if there's any questions on that, I will go into that. I do have some fundamentals that I tell patients across the board. Things like chew your food well. So these are like simple tips. Chew your food well. So that's where digestion starts, in the mouth. The more you chew your food, the less work that your other organs have to do in order to be able to break this down and be able to get it into an absorbable form. Drink fluids between meals instead of with your meals, because having the fluids with our meals, sometimes we gulp down uh, bigger morsels of food with less chewing, and we eat faster. So if we have our meals separate from our fluids, we might chew our food more. Um, the usual limit ice cold foods that we do and say a lot in TCM. Oops. And the trying to avoid multitasking while eating. So being able to practice the mindfulness and enjoy the food. So I hope that that has provided some ideas. Were there any questions?
Thank you, Dr. Carr. I really like the approach of being able to, I mean, it's always about treating the whole person, but really coming from a very gentle uh, point of view, things that are completely in control for people if they want to take it.
Yeah, I think we have to ask them what it is that they're willing to do and also sometimes, what they can afford to do. So I once worked at like at a pharmacy where I worked in the natural health section. And I had an older woman come to me and she was looking for her multivitamin with the brand with the C at the start. I won't throw the name out. You see it advertised on TV all the time. Physicians recommend it all the time. I don't like that brand because it's poorly absorbed formats. It's in a very thick shell of like coating. I don't want people to be having what they put into their body. You hear these stories about like that you can see pills, that have gone through the sewage system. It's people have eaten
Mhm.
the pill and it's come out in the same format. So that is something that sometimes supplements are blamed for, but it's not really the supplement's fault. Sometimes it is our digestive system, and sometimes it is that, they've coated in this super thick coating that with a bunch of dyes and things that you don't really want in your body anyways, that makes it harder to digest the thing. And then, the format of it is poorly absorbed. So, um, finding out what works, what the person's doing, and getting the details of that helps us find some stuff that we can recommend.
It's a great additive, I think, to the treatment for sure. Are there any other questions?
I'm going to skip over these ones to get to just my, oh, there we go.
Oh, excellent.
Oops.
I
Yeah,
don't
so
think that, yeah.
I have so if you guys have questions after, I mean my email's here. drcarrtcm@gmail.com. I'm happy to share. I love talking to colleagues. I love talking shop. I am happy to answer questions regarding nutrition and TCM. If you have stories you want to share with me, your own experiences, I'm happy to hear that too. I have a book out, this book here, Modern Chinese Medicine Food Cures, that Opus is selling. And yeah, I really want nutrition to be something that we TCM practitioners are known for. So the more of us who are making recommendations, the more our patients will talk about it to their friends, like, oh, did you know? It's not just needles.
I like it. Thank you very much. And thank you to everyone for attending this evening and coming and listening to uh, another one of our expert speakers in our case presentation. We'll
Thank
see
you.
you all next time. Thanks, Dr. Carr.
Thank you.